Hello everyone, I am Dr. Anupama Chauhan, Senior Lecturer from Department of Oral and Maxillofacial Surgery, Narsibhai Patel Dental College and Hospital, a constituent college of Sakalchand Patel University, Visnagar. So today we will be discussing Exodontia in brief. You must be knowing what is Exodontia, okay? So starting with the content of today's lecture, we'll discuss definition, indication, contraindication, techniques of extraction, principles of extraction and principles of elevator. Beginning with the definition. So, exodontia is defined as the painless removal of whole tooth with minimal trauma to the investing tissues so that the wound heals uneventfully and there is no post-operative prosthetic problem is created, right? So next, there are two techniques for extraction, open method and closed method. Open method is also known as transalveolar and closed method is also known as intraalveolar extraction. Intraalveolar extraction is when we don't put any incision, we just place the forceps elevators, we do the movement and extract the tooth, okay? And in transalveolar, there is need of putting an incision, reflecting the flap, sectioning of the tooth if indicated and then the closure. So the basic instruments which we use for extraction is elevator and forceps. The indications of extraction: grossly decayed teeth or pulpal necrosis, severe periodontal disease, orthodontically malpositioned teeth needs to be extracted, okay, fractured tooth, tooth which is in the line of fracture, and tooth which is associated with any pathology like cyst or tumor and tooth associated with periapidal pathology. Along with that, the other indications are supernumerary teeth and when there is need for prosthesis in case of impacted tooth in edentulous arch. Okay, so that needs to be removed before. Then contraindication of extraction. It is divided as absolute and relative. Absolute contraindications are the condition in which the extraction has to be avoided in any criteria, okay? And relative is by which we can do some preparation for the extraction and then patient can be undertaken for extraction. Like if a patient is hypertensive or diabetic, we can control the blood pressure and we can control the blood glucose level. So absolute, the certain contraindications are central hemangioma, because if the tooth is extracted there will be heavy bleeding. Then arteriovenous malformation, same heavy bleeding, and other absolute contraindications are teeth in irritated area within 6 months to 1 year. Cases of myocardial infarction if the history is before 6 months, okay. In cases of first and last trimester of pregnancy, extraction has to be avoided because in first trimester there will be organogenesis and in last trimester there is risk of premature labor. And in cases of malignant tumor which can hasten metastasis. Talking about the relative contraindication is acute cellulitis, long-term steroid therapy and liver disorders because there can be risk of bleeding. Other way of classifying the contraindication is local and systemic. Local contraindications are same as the absolute contraindication, which is acute infection, malignancy, irradiation and proximity with vital structures. And systemic could be classified as physiologic and pathologic. Physiologic covers menstruation, pregnancy and extremely elderly patient, while the pathological consists of the systemic conditions like cardiovascular disease, cerebral disease like stroke, immunocompromised patient, hepatic disorders, then endocrinal disorders, neurological, hematological and renal disorders, and with respiratory system diseases like asthma, pulmonary tuberculosis, COPD and active chest infection. Next we'll be talking about the principles of exodontia. So the first is access and visual field. This is the most important because if there is no access, how will you hold the instruments, how will you look for where you have to apply the forceps? So there should be adequate amount of the access and visual field. Next is use of control force. So we know that while extraction we have to hold elevator or the forceps. And if we are not using the sufficient force or control force, then what will happen? Either will cause trauma to the soft tissue or we can fracture the tooth. So we should, whenever we are applying the force, it should be very controlled one, okay? And it should give control movements, either buccal, lingual or the rotation. We'll be talking about the forces, movement of extraction later. Then unimpeded path of removal. Meaning, if there is any obstruction such as impacted tooth or if malpositioned tooth is there, then we need to section the tooth also for minimal trauma to the investing tissue, as it was mentioned in the definition, right? Then moving to next is the expansion of socket. As we all know, the tooth has been anchored in bony socket, which is very tight. Okay, so for easy retrieval of the tooth, there should be some space present between the bone and the tooth. For that, we need to cause expansion of the bony socket, and how we will do that is which we will see further. So whenever we will apply forceps or elevators, we have to do wedging. We have to use principles of elevators so as to make a space between the tooth and the bone and cause easy extraction without causing any trauma to the patient and to the tissues. Next will be our principles of the elevators. Okay, so there are three principles: lever principle, wedge principle, and wheel and axle principle. We'll look after each one by one. So talking about lever principle. So lever is anything which will cause, which will help you in easy your work. Okay. So there are three components in class 1 lever. So there are three classes of lever, but while extraction we use the class 1 lever applies, in which fulcrum is always in the center. The resistance of working arm will be at one end and effort arm will be at the another. So the longer the effort arm, the more force will be generated at the working end, and it will help you in easy extraction. Okay. So when we talk about forceps and when we talk about elevators, how it is to be understood. See, this is forceps, this is your effort arm, okay, this is your fulcrum, the hinge will be fulcrum, and the working end will be your resistance arm or load arm. Okay, same goes for elevator. The handle is your long arm, okay, this will be your fulcrum and the working end will be your load arm. Okay, so whenever you are doing extraction with the help of forceps, you have to know that whenever you are holding your forceps, the hand should be placed very far. Okay, so it will help you to generate more forces at the apical, at the apices. Okay, and always we have to root towards the apical direction, and the fulcrum will be at the hinge. Okay, so this is how the lever principle applies to the forceps. You have to hold as far as possible. Okay, and when we talk about the elevators, so this is the forceps. Just the way I demonstrated. You have to hold at very far. The effort arm should be long so as to help you with the extraction with minimal trauma. And talking about the elevators. See, whenever you use elevator, you have to put it between the bone and the tooth. Okay. Same, your hand will be very fast so as to make the effort arm look longer, and then you will be giving the force. And whenever you are using elevator, always keep in mind you have to support the adjacent tooth. The fulcrum should be your bone, not the tooth, adjacent tooth. So this was about lever principle. Next, we move towards the wedge principle. So wedge is anything which will make space between the tooth structure. That is called as wedge. You must be knowing wedge from the second year endodontics. So this is your wedge. Wedge is any substance with true plane. There is base at the one end and blade at the another end. So this is an example where one has to split the wooden structure, and you can see whenever you use some wedge, it will be very easy to split the wood. Okay, we'll be putting force on this wedge, but it will be distributed horizontally so as to split the tooth. Okay, and same, see here when the elevator is applied, we are supporting the adjacent tooth. We are supporting the adjacent tooth. So avoid the luxation of this tooth. This is the working area. Okay, we should always support this, and then we are making space between the alveolar bone and the tooth. This is a wedge. See here also this elevator is placed between the bone and the tooth so as to make the space, and the PDL space will be enlarged and it will facilitate the removal of the tooth. And the principles, the instruments which work on these principles are the forceps and the elevators. I think it is clear now. See the way I demonstrated, this is the use of wedge principle. Okay, we are elevating this 8 and we are extracting by creating some space, and this is when you use your forceps. So you have to go apically as far as it is possible. You don't have to hold the crown, otherwise what will happen, you will fracture your teeth. So you have to move towards below, above the C, below the CAJ, okay? And it will help you to make the space between your bone and the tooth. And this is your last principle, wheel and axle principle. The mechanical advantage is maximum with this principle, and the maximum amount of force is created using this principle. So it is the modified form of your lever. When the handle is rotated, so when your handle is rotated, the force will be generated where? At the working end. So when you are rotating your handle, the force will be generated here, which will help you with the exodontia, with the extraction. Let's understand that by example of this pulley and bucket. So this is a wheel, this is the axle. When the wheel is moved, the axle rotates and it will pull your bucket. So the greater this diameter, greater the diameter of the wheel, the more force will be generated and more easily the bucket will be pulled, right? So same way, when we are extracting any root piece, okay, so we have to engage the root piece and we have to give the force. The more the force diameter generated here, the more will be the force at your working hand, and more easy it will be to lift the tooth. So mostly the principles which follow wheel and axle are the instruments which follow wheel and axle are the crier and crossbar elevators. This is your crossbar, okay. This is the wheel where we have the principle will follow. So the force will you have to do the movement here, and force will be generated at the working end. Mostly it is used to remove the root piece, not the whole crown. Sometimes it could be engaged buccally and the tooth can be pulled out. Next, the steps to carry out simple extraction. First is after the application of local anesthesia, you have to confirm there is an effect of any anesthesia. After that, you will reflect the flap. So that is loosening the soft tissue attachment. After reflection, you will just luxate the tooth. Okay? With the help of elevator, you will just luxate, not remove the whole tooth. After getting some mobility, after creating the space between the bone and the tooth, then you will apply the forceps. After application of the forceps, you have to give some root movements. Which are the movements I'll tell you. Okay, and then you have to remove the tooth from the socket. Major movements are the apical pressure, meaning towards your root. Apical pressure should be the first to be applied. Then there is labial or buccal pressure, lingual or palatal, and the last is the tractional forces, which is pulling out. And in cases of some tooth, like which are single and single rooted, their rotation movement can be applied, like maxillary incisors and mandibular premolars. There we can use rotational forces. So this is the next slide has some example of the forces. It will be demonstrated. So first, when you are rooting for extraction, you have to give your apical force. Apical force, then buccal force, then lingual force, and it will then the last will be your traction force, that is pulling out the tooth. This was the example where buccal and labial, buccal and palatal forces were used, and this is the example where rotational force is used. See, you have to go for apical pressure in any case. First we will give you apical pressure. The forceps should be below the CG. See, you can see the forceps end is not on the crown. It is at the root. So it will prevent fracture of the tooth. After your apical force, you have to move in one direction. Then you have halfway, okay? And then you have to move in opposite direction halfway. This will help you in luxation of the tooth and expansion of the socket. And later you can just retrieve the tooth. So this was all about the exodontia in brief. Okay, we'll cover the other aspects of exodontia in later sections. And I hope everything is clear by now. See you in another lecture. Thank you.